This video is going to give a very short introduction to nuclear medicine. We'll give an overview, explain why we use radiation, and give examples of nuclear medicine procedures. Let's begin. So, what is nuclear medicine? Nuclear medicine is the use of radioactivity in medicine to help diagnose and treat patients in a unique way. Nuclear medicine differs from other uses of radiation in medicine, such as X-rays, which come from a machine outside the body. Instead, radiation is injected, swallowed, or inhaled to get inside the body. We can break nuclear medicine down into 3 different types of procedures: imaging tests, non-imaging tests, and therapy. Let's talk now about radiation. Why would we use radiation? Isn't it dangerous? Everyone is exposed to small amounts of radiation all the time, from natural sources such as rocks and soil, to foods such as bananas and nuts. Whilst the radiation used in nuclear medicine is stronger than what we are naturally exposed to, its usage is closely monitored and controlled to ensure that the benefits outweigh the risks. The radiation used in nuclear medicine is removed naturally from the body in a short amount of time, often less than a day. We can combine radioactive substances with other materials, causing them to go where we want in the body. We call this mix a radiopharmaceutical or a tracer. Using a tracer, we are able to get useful information and treat diseases in ways that would otherwise be unavailable to us. Let's break down the 3 main categories in nuclear medicine: imaging, non-imaging tests, and treatment. Imaging is a large part of nuclear medicine. Scans such as X-rays and CT are able to provide great information about the structure of the body, but nuclear medicine provides us information on the function of the body. The tracer that is administered inside the body is able to be seen using a special camera which allows us to see where the tracer is in the body. Let's look at an example of an imaging test. A myocardial perfusion scan is a scan that visualizes the blood flow to the heart. The tracer goes to the heart and is absorbed by the healthy heart tissue, but not by unhealthy heart tissue. This allows us to see what areas of the heart are receiving blood and what areas are blocked, providing useful information that can be used by doctors. In non-imaging tests, a tracer is given to a patient. However, instead of using a camera, we take samples from the patient, such as urine, blood, or breath samples, depending on what we are interested in monitoring. We can measure how much radiation is in the sample to give us information about the patient. Let's look at an example. Blood volume test measures the total amount of blood present in a patient. The patient is injected with a known amount of radiation, and we wait a small amount of time for this radiation to mix evenly with the patient's blood. We then take a blood sample and measure the amount of radiation in it. The amount of radiation in the sample is compared with the amount of radiation injected, and we can calculate the amount of blood in the patient. Nuclear medicine can also be used for treatment purposes, also known as therapy. We use radiation that doesn't pass through the body as easily as in imaging, so it deposits its energy in a small area. This can be used to kill cancer tissue, reduce tumour size, or reduce pain. Let's look at an example. Iodine therapy is used to treat thyroid cancer. The only part of the body that absorbs iodine is the thyroid, so we can use a radioactive form of iodine, I-131, to treat thyroid cancer. The I-131 is absorbed by the thyroid and any thyroid cancer that spreads to other parts of the body. The radiation then kills cancer with minimum damage to the rest of the body. To quickly summarise nuclear medicine, radiation is placed inside the body and travels to a specific location. This allows us to perform imaging tests, non-imaging tests, and targeted therapy. Thanks for watching.
What is nuclear medicine? An illustrated introduction. From diagnosis to therapy. Diagnostic by imaging is an essential tool in the detection of many diseases, such as cancer. In the nuclear medicine department, a radiopharmaceutical is injected to the patient. Radiopharmaceutical distributes itself in the whole body and concentrates in the disease areas. It is taken up by the lesion, and any residual is naturally eliminated. The patient is then transferred into the camera. Radioactivity allows to provide an image. First pass gives an X-ray picture, and second pass gives a PET or SPECT picture. Fusion gives the PET-CT or SPECT-CT image. The images allow us to clearly see the lesion location. From diagnosis to therapy. Nuclear imaging plays a vital role in treatment or therapy for the diseases. The radiopharmaceutical is injected, diffuses into the whole body, concentrates in the disease, and progressively destroys the disease. Personalized medicine. Nuclear medicine has also applications in neurology, cardiology, oncology, orthopedics. These images help to anticipate if the patient will respond effectively to a treatment. Imaging allows us to look into the body, to see the organs, and to make the appropriate diagnostic and treatment decisions for the patient. Nuclear medicine is creating a future for personalized medicine. The radiopharmaceuticals journey. From where do these radiopharmaceuticals come? Radioactive products are originated either from reactors or cyclotrons. These products are then processed in radiopharmacies, where they are transformed into radiopharmaceuticals. Radiopharmaceuticals are then shipped to the hospital and eventually injected to the patient. These products have a radioactive short life, and after less than a day, the radioactivity has completely disappeared. An initiative of Association of Imaging Producers and Equipment Suppliers, European Industrial Association for Nuclear Medicine and Molecular Healthcare, and the AIPES Nuclear Medicine Awareness Working Group.
Understanding nuclear medicine. What is nuclear medicine?
Well, nuclear medicine is a branch of medicine and medical imaging that uses a small amount of what we call radiotracers or radiopharmaceuticals to diagnose disease and to treat disease.
How does nuclear medicine differ from other types of radiology?
Nuclear medicine really differs from other modalities that you may know about, like CT or MRI, which are, those studies are anatomically based. They look at anatomy, structure. Nuclear medicine really looks at physiology of the body, of all the organ systems. So we can follow the physiological processes as they occur in a living human using these radiopharmaceuticals and through use of appropriate imaging systems.
Why is it called nuclear medicine?
Well, it is called nuclear medicine because, as I said, we use a small amount of radioactive material, which are based on the nuclear properties of a substance.
How long has nuclear medicine been around?
Nuclear medicine has been around basically since the end of the Second World War. So I would say about 5 decades or a little bit over 5 decades. So it's, in that sense, it's actually a brand new area of medicine.
How does nuclear medicine work?
The way that nuclear medicine works is that we have the patient, of course, with a specific need that requires a nuclear medicine technique. Then we have the radiopharmaceutical that is administered to that patient based upon what the problem is, and we can go into more detail later on that. And then, of course, we have the imaging system that is required to basically take an image of the distribution, of the biodistribution of this radioactive material. For example, suppose a patient has a metastatic prostate cancer with lesions in the bone. We want to know how extensive there is the metastatic prostate cancer in the bone. And we have a radiotracer which is specifically designed for going to sites of bone metastases where the bone is being repaired or is reactive to the cancer. So the patient is administered with this radiopharmaceutical intravenously, and then after appropriate amount of weight for the radiotracer to be distributed in the body, then we position the patient in a camera system. And as I mentioned, we have these gamma rays coming off from that radioactivity that is within the patient. And that gamma ray is detected by these imaging systems. And then we have computer systems which gather up these gamma rays and form an image of the distribution of that tracer, radio tracer in the body. And then that image is presented on a computer monitor, which we can manipulate. We can In fact, these are not always static images. We have lots of dynamic images that we do in nuclear medicine. So we can manipulate them, we can look at them in different projections, different contrasts, colors, and basically in combination with the clinical data that we have on that patient, plus other imaging that we have available, for example, anatomic imaging such as CT or MRI or other imaging modalities, to interpret what we're looking at. And we put it all together to generate a report that is basically discusses what we see and what does it mean from what we see.
What are the benefits and risks of nuclear medicine?
Well, the benefits of nuclear medicine is quite many, and it has contributed to the well-being of humans for a long time through helping with diagnosis and especially more recently helping with therapy in many of the conditions that humans suffer, for example, thyroid cancer and more recently lymphoma. The risks are actually, compared to the benefits that we gain from nuclear medicine, is quite minimal. There is a radiation risk, but that's very, very small, and it's approximately the same level that you receive from natural sources. There is very, very little side effect associated with the administration of radiopharmaceuticals, if any. And therefore, the benefit to risk ratio for nuclear medicine is tremendous.
Who performs procedures in nuclear medicine?
Nuclear medicine is performed by a team of professionals. As the patient comes into the clinic, they are usually greeted by the nuclear medicine technician. These are certified technicians who administer the radio tracer and position the patient appropriately for taking the images. When the images are ready, they are presented to the nuclear medicine physician, who may ask for additional images or different maneuvers. And then finally is the nuclear medicine physician who interprets the images in association with all the other clinical data and correlative imaging to form a report, which is given back to the referring physician.
What are examples of the uses of nuclear medicine?
Nuclear medicine is more than just diagnostic imaging. Most of it is diagnostic imaging, but we do actually do a lot of therapy with radioactive sources. One of the major areas is treatment of thyroid cancer, where we give radioiodine for treatment of the cancer, the thyroid cancer. There are also radio tracers available for bone palliation in patients, for example, with say metastatic prostate cancer, which have bony pain in relation to metastatic disease. And these radioactive material or pharmaceuticals are used to alleviate some of their pain. Also, we can use, again, nuclear medicine radiopharmaceuticals for treatment of lymphoma, the low-grade lymphoma, and that has been its role has been expanding, especially recently.
What are some nuclear medicine exams?
Myocardial perfusion imaging, which looks at the perfusion of the heart in coronary artery disease. There are bone scanning that is usually used for looking at the distribution or extent of metastatic disease of some sort of cancer to the bone.
Which areas of the body does nuclear medicine help treat?
Well, nuclear medicine is used, as I said, for all organ systems in the body. Central nervous system, the heart and major vessels, for gastrointestinal tract, for urinary system, including the kidneys, for soft tissues, for bony skeleton, and the lungs. So basically every organ system is touched upon by nuclear medicine.
How is nuclear medicine used in relation to treating illnesses?
Nuclear medicine is used for a number of very important illnesses, including cancer, cardiac disorders such as coronary artery disease, inflammatory disorders, infections of any organ systems, including soft tissue and bone infections, and brain disorders, for example, and gastrointestinal and urinary disorders.
Are there any new up-and-coming applications for nuclear medicine?
There are always up and new coming applications for nuclear medicine. More recently, there has been a lot of expansion in the role of positron emission tomography, or PET, in a variety of different cancers and also other disorders. For example, in neurology, and Alzheimer's disease is one of the most important ones that PET is rapidly taking strides. From the therapy point of view, nuclear medicine is expanding its role in treatment of lymphoma, for example, and through radio-labeled antibodies, and that's going to expand even more, perhaps into other types of cancer.
What advancements will nuclear medicine see moving forward?
Well, there is always a stride for new tracers, new radio tracers, and that's why radio chemistry is very important in nuclear medicine. As we develop new tracers, we are able to look at other physiological processes that we haven't been able to look at very carefully or accurately in the past. There's also strides in imaging systems, especially in what we call hybrid imaging systems, which combine anatomy or a structure with physiological information through nuclear medicine. So both from the point of view of what is administered, radiochemistry, and from how we form the image through instrumentation, there are both great advancements that are going on today.